Hi, our project was on Wernicke's aphasia, and we are going to talk about Mildred. A little background, she is a 68-year-old female. She's widowed, lives alone with no family nearby. She lives a sedentary lifestyle. She enjoys knitting and volunteering at animal shelters, and her neighbors found her down and called 911. She was alert but aphasic in the ED. Her preliminary CT scan revealed that she had a CVA in the MCA distribution territory, posterior to the central sulcus and superior to the sylvian fissure, but there's no observable hematopoiesis. For our WHO ICF framework for bodily structures and functions, prior to her stroke, Mildred was insulin dependent. She had hypertension, hyperlipidemia, AFib, COPD, and depression. And then post-stroke, her language was affected, especially her receptive language. She had logorrhea, limited functional expressive abilities. Her cognition was also affected, where she needed tactile, verbal, and or visual prompts for sustained attention. Auditory verbal memory span was reduced, but her visuospatial skills were within functional limits.
And then some things that affect her activities and participation. She has poor turn-taking skills, and she uses inappropriate social language. She has difficulty engaging in tasks because of that attention. She's unable to participate in conversation due to logorrhea and output. And she also struggles to self-monitor in some of her personal and environmental factors. She is not aware of her deficits. She's more alert in the morning, and her frustration is low. She doesn't have that family around her, so that can be a factor of her depression and anger. And then she did have health conditions prior to her stroke.
So the life participation approach focuses on the following areas: communication and language environment, personal identity, attitudes and feelings, and participation in life situations. It's important to remember that communication is more than just information transfer. It is a social action that requires language, opportunity, activities, or context, a communication partner, and the confidence to try. So number one, focus on client-centered real-life goals under this approach. Mildred's real-life goal includes her desire to successfully convey messages, which will expand her communication modality of functional gross drawings to allow her to be a better communication partner across contexts. There's also an importance of focusing on personal choice of activities and level of participation. So by making tasks personally relevant, Mildred can engage and create a sense of fulfillment.
For re-engagement in life, Mildred enjoys knitting, so finding ways to connect Mildred to her hobby through conversation and or gross motor skills through treatment can help re-engage her in these activities, as well as treatment that's focused on attention, pragmatic skills, and conversational discourse would improve her self-monitoring and conversations and decrease misinterpretations. So understanding others and being understood would improve Mildred's relationships with people such as her neighbors, friends, nurses, and SLPs. For expansion of therapeutic settings in a variety of settings, this is wherein clinicians would work with Mildred in settings that would be outside of an outpatient setting or a clinic setting, and it would be beneficial to Mildred because it will help her re-engage in her everyday life. For focus on Mildred's understanding of language and her use of it, as mentioned above in her profile, when she is able to demonstrate how to do something, she still struggles to verbally convey it. So improving her use of language can help her to verbally express her ideas and tasks and participate in her preferred activities.
So our PICO question was, is semantic feature analysis, SFA, or verb network strengthening treatment, VNEST, more effective at improving word retrieval skills in adults with Wernicke's aphasia? Semantic feature analysis is a treatment approach targeting word finding abilities. The goal is to enhance naming abilities by improving access to semantic networks, such as group, action, use, location, properties, and association. SFA aims to help people learn to cue themselves independently and in everyday contexts to produce target words. SFA includes techniques that may strengthen impaired semantic networks, as well as therapeutic processes that may foster the use of tactics to circumvent the impairment. SFA has been associated with improving naming of treated items as well as untreated items for persons with aphasia, representing a range of aphasia types and severities. Some of the strengths of SFA are positive effects, demonstrated with a person's aphasia, representing a variety of aphasia types. It can be used with nouns or verbs, many languages. Some of the limitations are that severe aphasia may be related to poor response to SFA, or the fact that SFA approaches can range in variety from clinician to clinician. Here's an example of charts that you might use with SFA treatment. You would put a picture in the center, and as you go around, you describe the object that's pictured, and you are working to name that pictured object. We chose this because Mildred has good visuospatial skills and is good at viewing objects. These charts can be further adapted by using pictures for each of the semantic classes.
Verb network strengthening treatment, or VNEST, specifically targets the retrieval of verbs, and it can be challenging for individuals with Wernicke's aphasia to use those verbs and recall them appropriately. It often involves difficulty constructing grammatically correct and meaningful sentences when you have Wernicke's aphasia, so it can improve their sentence production skills and allow for more coherent and effective communication. VNEST aims to promote generalization of treatment beyond the therapy setting. So that means that they can transfer it to a variety of real-life communication situations. The main goal of VNEST is to enhance the functional communication abilities of people with aphasia by focusing on verbs and sentence structure to improve the overall effectiveness of communication in their individual daily life. Some strengths are that it can promote self-monitoring and add content to conversation. VNEST can help build a network of verbs and relate to their activities of daily living, and it can enhance their ability to convey those messages. And it often aligns well with their cognitive abilities. Some limitations, though, are that it may not be something that their retrieval issues can address as easily because of the lack of content production, and it may not work well in all different types and severity levels of aphasia. So we thought the treatment that would be best for Mildred was the semantic feature analysis because it targets her word retrieval difficulties by now analyzing the features of words, such as the attributes, category, or function, to help retrieve the word. It also utilizes her visual strengths and addresses the bigger issue of word finding deficits related to her diagnosis of Wernicke's aphasia.
Okay, and then here is a demonstration of the semantic feature analysis.